Hello, Dr. Goddard. Thank you for joining us today so that we can learn more about how somatic energy therapies can assist people working with functional medicine practitioners.
JP, it's a delight to talk with you about that today.
So I'd like to learn more about the specifics of what you do and how that works. Can you tell us how traumatic or stressful experiences end up being held in the body?
There's a metaphoric way of explaining it, and then there's the scientific way. I'll stick with the metaphor for now, unless we want to follow up on the scientific way. But there are two kinds of answers to this. I'll just start with that. The metaphor I think of goes like this. We experience at any point in our lives, but it happens most frequently when we're young, usually under the age of 7, that is too much for us to process in that moment. You can see why it would happen more frequently when we are young, because we have fewer emotional and cognitive tools to cope with a stressful situation or an overwhelming situation. But whenever it happens, whether in childhood or in adulthood, we get hit with a situation and we don't have what it takes to fully process it. Emotionally, physically. I mean, think about this. Your parent says something that angers you, and then you start to feel the energy of anger arise, and your parent says, I don't want your anger here. Your anger is not welcome here. And you don't know what to do with that. So you stuff it because that's what's required of you, to be safe, perhaps, at least emotionally safe, and in some households to be physically safe. So you stuff that energy in your body, that anger energy in your body and in your subconscious, and lock it away. And what that can then do is find its way into muscles and neural pathways that remember at a subconscious level that event. So that muscular structure and your neural pathways remember that outside of your awareness, in your body, in your subconscious, but outside of your conscious awareness. That then is a reminder, or it becomes a reminder for future events. Some other event, unrelated, years later, maybe decades later, will happen and trigger this unprocessed energy in your body. And it's a problem because we don't have any awareness that this is going on, so we act automatically in a response. We might act out with over-the-top anger that seems out of proportion for the event at hand when decades later. Or it might cause us to not take a course of action because we somehow have some unconscious fear of going there, wherever there is. Our body remembers, but we may not in our conscious awareness. And so that's the metaphorical way of describing how it happens. We can't process an energy, it becomes stored in our body, and then somehow it informs how we view the world and how we respond to the world that we are viewing.
And how might these energies show up as physical illness?
Well, the easiest way to think about this is, and the most common in my experience, is stress. Stress, we have lots of, and you're a greater expert on the chemical situation here, but I think it's pretty common knowledge, even to non-physicians like myself, that stress is related to the release of a variety of hormones. First and foremost, as I understand it, is cortisol. And elevated cortisol levels are associated with all sorts of illnesses. In fact, it's hard to imagine many illnesses that it's not associated with. And again, you're the expert on that, and I am not. But I've seen study after study that not only relates it to illness, but relates it to our inability to heal from injury or illness. It affects our ability to respond to injury or illness by lowering our immunoresponse system. So very serious illnesses are associated with elevated cortisol levels. You're a greater expert on that, but it's my understanding it's related to a variety of heart issues. It's been associated with cancer. And even wound healing. I've seen studies, rather very beautifully designed studies, that demonstrate this one-to-one relationship, which is almost never found in human experience, where you get 100% correlation between something over here and an impact on health over here. But I've seen a study that related to healing from a very specifically induced injury, with volunteers, of course, who knew what they were getting into. And it was a minor injury. It's a little bitty cut, beautifully controlled experiment. And 100% of the subjects healed more slowly, dramatically more slowly, at a period when they were all under a period of stress than when they were not under a period of stress. So it's really the full spectrum of illness and injury that's impacted. In addition to that, these stored energies act as though, think about it like a wound. At first, if you have an open wound and no bandage or clothing over it, and you touch it, it's very sensitive. So that's what I was talking about earlier. It's very sensitive, and you might respond in an oversensitized way. But then think about what happens. It builds a scar, which is tough and it doesn't have any nerve endings in it, and it's inflexible, and it doesn't grow. It's just a scar, and it can happen externally on an outside wound. It's easier to think about it that way for a lot of us. But of course, we know that this happens internally as well. Well, then what happens? We lose contact with what we're feeling. And so we're less able to respond to symptoms because we don't even notice them. Because if these energies are, to get out of the wound metaphor and go back to the stored energy, if these energies leave the emotional and psychological equivalent of a scar, we don't want to feel it. That's a piece of us we don't want to feel in our bodies. And if we're insensitive to our own symptoms, we're more likely to leave those symptoms untreated, and therefore even the ability to catch early stages of illness before they develop into more serious illness is impaired. In fact, all along the way in the course of development of the progress of an illness, our ability to even notice what we really should be noticing if we were not scarred emotionally becomes impaired.
What are some of the clues you use when working with functional medicine patients that help you uncover emotional root causes which might be contributing to their illness?
Well, some of it is just being with the patient. Some of it's just noticing. There are certain ways of holding the body, certain ways that weight is distributed in the body, certain muscular patterns that you can see in a body that are revelatory, because these held energies can actually impact the way we develop over the course of our lifespan. Even in adulthood, these held energies can change the shape of our body. So that is a basic beginning point. There are certain body shapes that kind of speak volumes about what has happened in this person's life. So that's a starting point. But more often, and what's most useful to me personally as a somatic psychologist, is inquiry about what the client feels in his or her body in that moment. And so it might be, so where are you feeling this irritation or this sadness, for example? I'll check in with my clients as we start out, and I'll say, so how are you feeling this morning? Well, I'm feeling some tightness through here, and I'm feeling some twitching in my right leg. And so they describe to me what they're feeling in that moment. And then I kind of listen for, is this held energy, or is this a actual physical injury, or a feature of the disease? Because I've done a careful intake, so I know about any injuries that might impact their ability to work with energy. But very often it's oh, I feel a tightness in this part of my body, or I feel a lot of energy or vibration here. I'm feeling kind of numb over here. And so there are a whole variety. Once we're informed about that through the conversation about the body, then I might ask about, all right, do you feel any emotions associated with this? But sometimes I might not even go to emotions. We might just stay with the body and say, all right, well, let's move that energy. And there are a variety of exercises and breathing exercises and movement exercises that move that energy. And these processes, these physical processes that I invite my clients into, offer two major benefits right off the bat. One is they might stir up energy so that we find other places where energy is held, because the energy moves sometimes with movement and breath. And so it might start with an energy up here, and then with movement and breath, they might find a holding in their belly, for example. And then we might do an exercise or breathing processes that are designed to move that energy. And so we just listen to the body and then follow that energy with movement and breath. And then I ask my clients, what are you noticing now in your body? And are there any emotions, images, memories? And then we have a conversation from there. And it might lead to more movement. It might lead to more conversation. It might very often leads to a discussion of a family of origin situation. Oh, this reminds me of my childhood when my dad required that I be this way, or when I was with my grandmother and I could tell that she didn't want me in her house, or something like that. And then we follow that. And very often just bringing to light help is also a part of moving the energy. Because remember, these are all previously in the subconscious and in the body. And then by moving the energy in the body and then talking about it, it brings it into conscious awareness, all of which is in the service of freedom. I am not free to make certain choices if my choices are being governed by these hidden energies in my subconscious and in my body. But if I bring them to my conscious awareness and move the energy in my body so that it's not stuck there, then I at least have the possibility of making some conscious choices about what I want to do next.
Great. So we often associate inflammation in many different ways in the body with being inflamed emotionally, that is, anger or frustration. Can you tell us how you might spot if that is related to a deeper physical illness issue, and then what you might do about it?
Well, again, it very often comes back to stress. Inflammation and stress hormones are closely related in a lot of people, but not. It's not a one-to-one relationship. There are other causes of inflammation. It might be a rash in a certain part of the body that is revelatory of, if a person has a rash on their back, it might suggest that we might move some energy in their back to release some. And the back is often associated with resentment, and so it might be that might be a clue. Different parts of our body hold different kinds of energy very often, and it might be a clue as to, well, let's move some energy in the back, and then I might be listening closely for resentment or something closely related to that emotionally. Inflammation shows up in so many different forms: rashes, or wounds that are slow to heal, or outbreaks of acne, and so we kind of look for those spots, see where they're located, and see if we can move that energy. And very often it's related, we find in that work that it's related to some underlying and unexpressed emotion. It might be unexpressed anger. It might be a grief around carrying too much. It might be a grief about loss. It might be a shame energy. I've seen some inflammation that's related to shame. So again, it's kind of noticing whatever is going on with the body, whether it's inflammation or holding, or even extra energy, and then seeing what movement and breath and conversation can do to bring whatever's going on into conscious awareness. And the idea here is revelation. We're trying to get our clients, those of us in my field, are trying to get our clients to be more intimate with their entirety of their being, their bodies, their psyche, their minds, so that it's one unit. We have a tendency to split them into pieces and then maybe not even be aware of what's going on. And so a lot of the work is simply about bringing awareness to the whole energetic and physical being of the client or patient.
Can you tell us what you might do when you have someone where anger or frustration is related, and how would you help them to move that energy?
Anger and frustration can be moved in a zillion different ways. I'll just give you a couple of examples. And I do this both in my individual work. I do a lot of work on Zoom, and this can happen over Zoom. It can happen in person. And I also do this in retreats. It's a simple thing. I'll just give you my own experience. When I'm feeling the energy of anger coming up, in my office, I have a bat and a tennis racket. And my office is next to my bedroom, and I just grab one of those tools of hitting. I go into the bedroom, and with a particular way of hitting the mattress, there's not just random hitting. There's a trained way of hitting the mattress. Generally with the tennis racket, it makes for a wonderfully satisfying loud noise to just hit over and over and over, because a lot of my anger gets stored up in my back and upper body. So if that's where I'm feeling it, then I do an upper body movement or recommend that to the client. If the client tells me I'm feeling rage in my shoulders, then I say, all right, well, let's grab your tennis racket and go to the mattress or your couch and give it a good whack. I lead them in how to do that properly so they get the full benefit out of it. And then they just whack away. Sometimes we use that even for issues other than anger, just to move the energy, but it's a wonderful way of expressing anger. In a retreat, I have a large foam cube that is designed just for that, for hitting and some other exercises. And then after that exercise, there are a couple of processes once that energy is released from where it's being held. They're called grounding exercises that move the energy throughout the body, because what we're trying to do is release the energy and then restore the body to an energetic flow. This is life force we're dealing with. Our life force wants to move fluidly through the body. And to do that, sometimes we have to use vigorous exercise in certain ways to do that. Now, if it's a whole body experience or a lower body experience, there are some lying down exercises that I recommend and guide my clients through, both in person at a retreat or in a studio or in a Zoom call. And one of my favorites, in fact, I was doing it this morning. I was feeling something in my whole body. I wasn't quite sure what it was. And so I hopped on the bed, excuse me, hopped on the bed and threw what I call a tantrum. And it wasn't really a tantrum. It just looks like a tantrum, where I'm on my back, pounding the mattress with my arms and my legs, and then wagging my head back and forth. That's primarily so that I don't think too much. If you wag your head back and forth while you're doing all this exercise, you don't think too much. And you just pound vigorously until exhaustion. So you pound no more. And then there's a grounding exercise we call dead bug or dead cockroach, where you put your arms and legs straight up in the air in a certain way. And I guide my clients through how to do that. And that helps distribute that released energy throughout the whole body. That exercise actually is recommended by one of the early creators of the field known as bioenergetics, Alexander Lowen. He was a medical doctor and wrote a book called Bioenergetics, not surprisingly. In that book, he says, I recommend this exercise for all my patients to do every day. I don't do it every day, but I do it when I feel energy that is locked in my body. And I say, I don't know what this is, but I just want to move it. And same with my clients, if I feel like it's fully distributed. Sometimes in a retreat particularly, but it's also been done individually, there are kicking exercises. I might put the cube, this big foam cube I've got, up against a wall and have the person lie down on their back, and then put the energy of their legs, which have the biggest muscles and the strongest muscles in many people, and have them drive that energy over and over and over into the cube, which can also be an effective way to move energy.
Can you tell us how the retreat process might differ from working only as an individual?
The main difference is that a lot of this work benefits from being done in the presence of others, to be witnessed. So let's say, for example, that one of the issues that's been locked in your body is anger. You weren't allowed, for example, to express anger in your home. Certainly I wasn't. And I think in many homes there's a discouragement for children to express anger. Don't express anger here. If you're going to yell, go yell in your room, or don't yell at all. And so that sets in motion for many people a deep-seated idea, which becomes housed in their personality and their subconscious, in their bodies, that if I get angry, people will leave me. Or if I cry, people will leave me or judge me. In the retreat setting, which is very carefully designed so that there's a safe container for the participants in the retreat to express themselves fully in their anger, in their grief, in their sorrow, in their shame, and to move that energy in a very big way, perhaps a bigger way than they've ever moved it in their lives. And this often happens. And then to look around the room and see, oh, everybody's still here and still caring for me. They haven't left. So that's something that is done in the therapeutic session individually, but it's only me. It's only me who doesn't leave. To have a group of lay people that you formed a bond with in the building of this container, witness your process and stay with you, can be an enormously valuable process to these deeply buried parts of ourselves that suspect that if I show myself for who I actually am and my authentic feelings of grief, anger, shame, then I will be left alone. And that would be catastrophic.
Thank you, Dr. Goddard. This has really been a fascinating conversation, and I look more forward to hearing more from you.
Oh, it's wonderful to talk with you always about these things, JP.
Have a great rest of your day.
You too. Bye-bye.